I felt like I had a target on my back.
It's a terrifying new reality many veterans are facing, surviving in a pandemic world.
Older male with pre-existing conditions. That's me and every Vietnam veteran I know practically.
And it's a growing fear in the community, especially after the Department of Veterans Affairs released disturbing new numbers. At least 985 patients known to have died with COVID-19, receiving some form of care from the VA healthcare system that serves 6 million people. 985. That's more than most states.
Like everyone else, it was a little behind the curve.
Outside of the federal system, deaths at many state-run veterans' homes have skyrocketed.
This disease, once it got into these nursing homes and these veterans' homes, before anybody knew it, it was running rampant.
Veterans advocacy groups have had questions for the VA on any number of topics, including its use of hydroxychloroquine to treat the virus, and whether it did sufficient outreach to veterans who were particularly vulnerable. Perhaps most importantly, however, is the question of oversight of state-run facilities. According to a report from the Vietnam Veterans of America, more than 550 residents in veterans' homes across the country have died from this virus. And not all states are reporting. And families of those residents have been forced to face unfathomable and painful realities as their loved ones fight for their lives, sometimes remaining in the dark as they wait to hear if their family member is still alive, as in Holyoke, Massachusetts, where more than 70 residents have died from COVID-19.
I took a grease cream and I wrote on my car, "Is my father alive? Shame on you, Soldiers Home."
And in New Jersey at Paramus, where 72 residents of one veteran's home passed away.
They gave us only 15 minutes at the cemetery.
But despite the VA partially funding and overseeing these state-run homes, Secretary Robert Wilkie is bucking the blame, instead pointing the finger at local governments.
We take complaints. When we hear complaints, we cannot impose our will on those state venues.
The VA press secretary tells CNN that federal law states that the VA, quote, shall have no authority over the management or control of any state veterans home, and that individual states, not the federal government, quote, are solely responsible for the operation and management of state-run veterans homes and any problems that arise within them. But the law also states that Secretary Wilkie can inspect any veterans home whenever he wants. And former VA Assistant Secretary for Policy and Planning, Linda Schwartz, says Wilkie can create and enforce guidelines to hold these homes accountable.
They have the authority to make changes, and they have in the past.
And she would know. She was the Connecticut Veterans Commissioner for 11 years and managed all state-run homes there, directly dealing with federal VA oversight. And she says urgent action needs to be taken.
There is a real need to do an analysis of what's going on here and what are the needs of the population. And it can't be something that takes years. It has to be now. Taking care of veterans is a great honor and a great responsibility.
And as we approach Memorial Day in the middle of this pandemic, it will also be a moment for the nation to pause to reflect on the lives of veterans lost and what more might have been done to prevent it.
It's sad to think how many we will be mourning this year who died because of a virus and not on the battlefield. But in a way, the battlefield is in the streets of America today.
When we asked the VA if they would do anything different, a spokesman said that the VA grieves for all of the veterans and loved ones affected by this heartbreaking situation.